We got Senator Nicole Akins-Boyd. She represents Panola and Lafayette counties. What are the committees you're on or chairing these days?
So I chair universities and colleges.
Yeah.
I'm vice chair of Medicaid.
That's right. Yeah.
So yeah, and then kind of chair the Women, Children's, and Families Study Committee, as it's called.
That's right.
So yeah.
So let's talk first about 25 session. There was some rather significant legislation that flowed through your committee, and that's this sort of anti-DEI bill. You and I talked about that offline some as well. That went into effect, right?
It did.
July 1. Tell us about that.
So that went into effect at our universities and community colleges. They all have adopted policies, and at our K-12 institutions across the state. So all of those adopted policies, it is in litigation right now. The state has been sued over that, and we expected that.
Yeah.
And they've been sued across the country when these have gone into a place.
Yeah.
There hasn't been from a lot of the individuals who are implementing it. You've seen some pushback, but not to what maybe you would have thought.
Okay.
It has actually been embraced by some. Because a lot of the provisions that we have in that bill are provisions that the Supreme Court had said that we needed to do. It's also a bill that they have found that a lot of the policies and procedures that had been done in the past actually did not do what they intended to do. There was kind of a backlash with some of the things that were implemented. So I haven't seen and I haven't heard from a lot of individuals, except those that are suing right now. And
so a little remorse on that, perhaps, huh?
Well, I think we have a good bill. We have a good, strong
No, I'm talking about the university center. That wasn't exactly what we had in mind. It kind of took a life of its own, and they maybe have some remorse about the initial implementation of those policies.
When you're a professor and you're sitting in a training session that is being done maybe by a national institute that's come in, and you've got to go through this for your accreditation purposes, and they are requiring you to adhere to things that you don't personally agree with, that you don't agree with, and really not your religious beliefs, or really you just don't believe is practical.
Sure.
I think that's a difficult position to put these professors in.
Yeah.
So I think that by putting these provisions in there, we protected those professors, and then their students as well. I've had graduate students who said, I've had to go to training classes that I don't agree with this, and I don't think the practical applications are the right thing.
Yeah.
So I think these are good things. I think that we tried to set a level playing field where there would not be any bias towards any type of ideology. So I think we were trying to really let people teach the subjects they need to teach in a way that is not political.
Yeah. So needed, so necessary. And, of course, the president, he issued a series of executive orders kind of revoking what the prior president had done that required and mandated all that throughout government.
Exactly. So I'm anxious to see what the courts say. We will look at it. We will work with all of this. Nationally, most of these have been upheld. And so they've been challenged and they've been upheld in most of the places because it really does try to level a playing field for just people to teach their core subject matters.
I suspect it's a bit of a relief for many that's what they want to do. That's what they signed up to do, to teach in higher ed, essentially.
Well, and I've heard from a lot of higher ed professors, especially living in a college community, that they are pleased.
Okay.
They just want to teach.
Yeah, sure. Yeah, okay. Well, that makes total sense. I mean, there was some other laws that went into effect as well. We might get to those in a minute, but let's talk about this opioid settlement and explain that to the folks where we are on that.
So Mississippi, most people are aware, did an opioid settlement with there's been really 5 major settlements with the lawsuit with the opioid companies. And so it has resulted in settlements with these companies. We in Mississippi are set to receive about $410 million total from these opioid settlements.
Okay.
And the court requires you to develop a process of how you're going to spend these monies to make sure that you adhere to the terms of the settlement. And so what the Mississippi legislature did, and we'll be looking at about $259 million of that money. So what we did is we want to make sure that what we do, is effective. We wanted to provide some transparency and accountability with these dollars to the public. And we also wanted to gather the experts at the table. And so we've put together a process. Some of the other states have kind of put a similar process in place where we have an advisory committee that will be vetting all the proposals that we'll be looking to fund in the legislature.
Okay.
And they'll be making sure that they comply with the terms of the settlement. And then hopefully they'll be giving us what they believe the priorities should be in expending in these areas. Because our opioid crisis, we know, affects every aspect of life in Mississippi. It affects our judiciary system, obviously. It affects our criminal, all of our correction system. But it also affects a lot of families and CPS.
And our economy.
Exactly.
Yeah.
It affects the workforce. So there are so many different areas where interventions are needed kind of in this area. And Mississippi, we've been really trying to fight this in a number of ways, but this is going to give us a lot more tools to do this. Mississippi we've put naloxone out there to try to treat when you have an overdose. Our local first responders are doing a great job at that. The Attorney General has really done a great job with her One Pill Can Kill, really getting that information out to young people, particularly on those college campuses. But when you talk to our first responders every day, they say, we've got to do more and more, and especially when you talk to our local law enforcement.
Okay.
So I'm excited for that committee to get up and going. We've got a great committee. There's been some great appointments to that. It's people who have expertise in all different areas. It's people whose families have been affected by this in a very personal way. So I look forward to this committee working and really doing some great work for the state.
What are you hearing about that didn't get a lot of attention, but it's something that's starting to get so because it's going into effect, the panhandling license you got to have, and setting up tents. I can't remember exactly the words, but encampments. That's right. So we got a break. We'll come back. We'll keep talking. We got Senator Nicole Akins-Boyd in the Element Well Studio coming right. Well Studio. It's middays. We're visiting with Senator Nicole Akins-Boyd from Lafayette and Panola counties. Okay, so let's finish up on the panhandler and the encampment bills, I guess, for lack of a better way to describe them.
Well, most people remember Giuliani. Before he came into office, New York was horrific.
Yeah.
They had panhandlers on every corner. There was a lot of stuff going on. And so they had a crime rate and all that. And they put a significant effort into looking at panhandling, encampments, all of those things. And what they saw is that was kind of indicative of a change that could be occurring. And so when they got control of those things, they started seeing decreases in crime. And so there's been a lot of studies written up about this. And so it's been kind of interesting to me that we've gotten a little bit of criticism, not a little bit of criticism, quite a bit, about requiring now that we get rid of the panhandlers. And I will tell you, going through many of these intersections in this city, as I'm down here so much, these are dangerous.
It's a problem.
It's a problem. And when they're coming up, banging on your windows, you're afraid to move your car because you don't want to hit these individuals. This is a problem. And it also is a bad look for our capital city.
Yep.
So, I understand people's concern for people and want to help people, but go help them in other ways. But this is a safety issue. It's a public safety issue. They are going to get hurt. And so we need to get these people off the streets from panhandling. It's not a good thing.
It's surprising we already haven't had some sort of serious accident.
Yes. And there's certain intersections that you go through in this community that you know that you've got to be totally head on a swivel because you may hit someone. So this is a practical thing, and I think everybody needs to realize it. There's plenty of evidence from places all over the country who've done things like this and really kind of helped clean up their cities from a lot. And this is a place to start. So I think this was a great bill. Representative Yates really pushed it. I know. And then the encampment bill, my colleague Chad McMahon pushed this from Tupelo. And so you are seeing these issues all across the state of Mississippi.
Yep.
And so this is a proactive thing we can do. And all we're really doing is we're putting this in the power of municipalities to handle this.
Yeah.
And that's exactly what we need to be doing.
Sure. Makes sense.
So let the locals look at it.
Let's pivot to the big, beautiful bill. I'm looking here on the screen. Representative Hakeem Jeffries still at the podium. He's in about hour 8 now, isn't he, Rhino, I believe?
Not quite that bad. I think it's hour 5.
Oh,
he's been doing
okay.
it a
Pardon
while.
me. But he may not be going away for a while. Maxine Waters is flanking him to his left. So all eyes have been on this, Senator, because we in all the states received lots of money from the federal government, and this could affect our budget. How do you feel at this point?
Well, right now, I've been, obviously as Vice Chair of Medicaid, I've been paying a lot of attention to this, and you've had some people on already that kind of discuss kind of the implications of this. But the other thing I'm really paying a lot of attention to as Chair of Universities and Colleges is what this means for the state of Mississippi. There's going to be changes to Pell Grants. We have about 45%.
That's a big thing, too, man.
It's a huge thing. And so we have about 45% of our students in Mississippi, whether you be at community college or at IHL, that are on Pell Grants. So what are the changes that we're going to see in that arena? And so that's going to roughly affect around 70 to 80,000 Mississippians.
So my understanding is there'll be some either limits or maybe total restrictions on part-time students, right? That's the big thing I'm hearing people talk about.
Well, so there's different. So the House and the Senate obviously have different versions of this. And so in the Senate version, someone would be limited to a lifetime cap of 100 to 200,000, depending on if you're just an undergraduate or a graduate student. There's also some limitations on parent plus loan limits. Both of them put limitations on the limits that a parent can take out for these children through these loan programs, where they've kind of been unlimited before. They're going to put the House has a 50,000 per parent limit. The Senate version has a 65 per thousand limit. And so there's also the structure of the loan payments. They're looking at changing very much. The House version put a 15 credit that you had to be taking at least 15 credits.
Which puts you almost as a full-time student.
It puts you as a full-time student. The Senate version did not do that.
They didn't do that, right.
The Senate version didn't do that.
That was a big concern.
Well, and that's a big concern we have a lot of Mississippians who have a little bit of college and not a lot of college.
Right.
Have not finished that terminal degree.
Yep.
And we need those individuals to go back and get those degrees because to maximize their revenue that they can make in the workforce.
We also have a lot that are enrolled in our community colleges that are working.
Exactly.
And thus there's part-time students, and they would be no longer eligible.
Yes, so I was very pleased to see the Senate
change that.
Make those changes with that. Particularly, we have a lot of single mothers.
Yep.
And we know, I'd say it every time I come in here, but we know that single mother labor force participation rate is 20% higher than our general population. And those women out there are trying to get more education so they can increase their earning potential for their families. So I think that's really important. It also looks at endowment taxes for very large endowments.
Yeah.
We don't have endowments in Mississippi that are reaching those levels yet that we're really worried about those huge taxes on that. The other thing too is there's a credentialing Pell Access for the Workforce and Trades program, and this is something I really like in here, is really making sure that those that want to get short-term credentials are eligible for some Pell supplement with that. So I think you'll see, if that comes into place too, I think you'll see the amount of these short-term credentials really being increased from our community colleges and even our IHL institutions if they're able to offer that. And that really does help upskill our workforce in Mississippi. And that's really what our workforce needs in Mississippi. We need that upskilling. And so those are some things that we can do with that. They also have some interesting things on accountability.
Okay.
Really looking at really telling universities that you've got to make sure that the degrees that you're offering the students are of value.
Do you have a problem with that?
I don't have a problem with that.
Yeah, me either.
I think it's going to, now I think it may bring some challenges for some of the state, particularly. I was looking at this and trying to go, okay, our social workers who we need not just in our CPS system, but we have them in hospitals and nursing homes, and we have them in many places across the state, but they're not high wage earners, and they're not high wage jobs. And so that's going to require the marketplace to make sure that those salaries are conducive on degrees like that. So there's going to be some implementations with that. But I really do think it's going to push everybody with all these changes that are being made is to being smart consumers. Own their college dollars.
Should be.
And they should be. So I have a daughter who looked at all of her options when she was headed to college, and she had offers at maybe more name brand, higher private institutions, and she chose a public institution because it was her scholarship basically covered all of it, and so she covered that. And she said, I don't want to graduate. I don't want to be in debt. I don't want to have loans. And so that was, something that she really made a smart decision and looked at those decisions. And I think everybody needs to be doing that.
Yeah.
So people talk about graduating undergraduate with all these hundreds of thousands of dollars in debt. And you're like, okay, where did you go to college? Because you can go here and get the degrees you need. And then if you want to go to graduate school and all of that, you would be in much better position to incur that debt.
Well, and they unfortunately they know they got lots of financial aid available from the federal government, which is just lapping onto our debt, unfortunately. So.
Exactly. So I think these are things that there's going to be some changes. I'm concerned about some of the changes and what it can do to our students.
Yeah.
But I also to understand the general policies behind it and how we move forward with that.
We didn't get to Medicaid. Can you hang around?
I can't.
Okay, we'll get to that next because you're on the committee, vice chair of the committee, right? So it's a big part. We're coming right back. Stay with us. Studio. We're visiting with Senator Nicole Akins-Boyd from Oxford, represents Lafayette and Panola counties. So let's talk a little bit about Medicaid, and just as a backdrop, and we say this a lot on the show because I just think it's important for Mississippians to understand this. The total amount of money spent on the Medicaid program, you could consider combined federal and state funds, it exceeds that of the general fund budget.
Yes.
It's $8 billion and headed to $9 billion, honestly.
Right.
It's $1 billion line item to the state, but because the federal match is based on per capita income, we have the 50th in the country, we get the most money from the federal government. It amounts to roughly $8 billion a year. Our general fund budget, we just passed it, 7 and change. It's a huge program, and one of the problems with it, of course, is that, as you were talking about, the reimbursement rates are so low. It makes it very difficult to recruit providers. And it puts enormous pressure on our hospitals and everybody that takes Medicaid, which seems to be limited. Very few highly specialized physicians and clinics accept Medicaid, as an example.
Well, the ones that do it purely because they love their community and want to serve their community.
And many in their community only have Medicaid.
But that is the only reason they do it, because when you start running the numbers on that, it usually costs them.
Yeah.
To do that, but they do it because they want to serve. They're there to serve, and so that's one of the reasons they do it. But kind of interesting on that fact too, as you just brought up, is you have low Medicaid reimbursement. Medicare, no one's getting rich off that for sure. That's just a little bit above Medicaid. And then we have the lowest commercial rates in the country.
Yeah.
And so I can assure you.
Bad combination.
It's a bad combination. And I can assure you the rent in Oxford, Mississippi is not that much different than it is anywhere in Tennessee.
That's
so
true.
It's probably more. So it's not that we have lower cost because our staff cost us if you want to get good people, they cost. And so, so those margins that healthcare providers are operating on are very small. And most of them, the good thing is they do it because they want to serve people. but they also they work very hard too.
Yeah.
Used to, you have it was typical that healthcare providers would close their clinics down, one afternoon a week. You don't see that at all anymore.
Yeah.
You've got those clinics going full time. There's not they're not on the golf course
Right.
in the afternoons, I assure you. So because you've got to keep those revenues going because those margins are so small.
Yeah, it's so true. And of course, we were all on pins and needles. But the whole country was on what the Congress was going to do to the Medicaid program, because Mississippi's not unique in that it's a huge part of state budgets across the country, just as it is here, the number 2 line item behind education. If you take a look at all the other states' budgets, it's pretty much the case in every other state as well.
Right.
It's massive programs, and it's almost doubled in size, I think more than doubled in size since Donald Trump's first term. We got some 72, 73 million Americans enrolled in the Medicaid program. It's about $630 billion a year of just federal money. It's north of $1 trillion when you put federal and state together. And it's kind of on a runaway train course that's concerning people. So what do you think about what the Congress is doing, the work requirements? That would be for the expansion population, something we didn't do here in Mississippi.
Well, so just
as an example.
Well, just to go back to that too, in this expansion population, when we looked at that in the state legislature, the Senate plan had a very, very tight work requirement.
Yep.
And the work requirement they're looking at on the federal level for those expansion states is very similar to the work requirement we had. Ours may have been just a little bit more, but it is very, very similar to what we had. And that was something that we thought was absolutely essential for the state of Mississippi and for anybody. Work is good.
Yeah.
People are healthier when they do work.
Yeah.
And
the
so,
dignity of work and, and the rewards of working, I just can't understand why anybody would oppose that.
Well, I just thought it was absolutely insane that when programs, many states passed a work requirement and the Fed said, no, you can't implement your work requirement.
Right.
So I thought that was absolutely insane to begin with. So I like seeing the federal government put those work requirements in. Obviously, when we looked at it in this state, that was one of the things we felt was absolutely essential. In fact, our entire body wouldn't have passed anything without a very strong work requirement.
The House version said we're going to try it, but if we get if the waivers turned down by the federal government, we're still going to move forward. The Senate version said no, we're not.
No,
that was a main difference between the two.
It was the big main difference. Yeah. So we were absolutely dead set that you had to have it, because we all philosophically believe too that was absolutely essential, that it's good for people to work, it's healthy,
and that's fine.
So I like seeing the direction of that. One of the things that has driven up the cost of a lot of this is prescription drug prices. And so I think that these are good things, but I think we've got to really keep really address and really focus on those prescription drug prices as well, because that's one of the things that keeps escalating the Medicaid budget. So we can talk about these things, but if we're not really hitting some of those things that make it, more expensive.
Kind of limited what you can do at the state level.
Exactly.
Though, right?
I mean, we're very limited on what we can do at the state level. So if we really want to hit Medicaid and those things, we need to really also be focusing on what is driving up those healthcare costs.
Yeah.
So, and that's one of the things that's driving it up, because, your Medicaid payments for providers and all of that have not changed. In fact, Medicare keeps reducing those provider payments, which is kind of illogical, because none of their costs have gone up, but yet they keep reducing those costs on that. So,
and I know you're married to a physician, right?
I
am. Are you familiar with the so-called doctor fix? Have you ever heard that term?
I have not heard that.
Yeah. So there was legislation. This is, I want to say, pre-Obama.
Okay.
That was supposed to schedule a scheduled increase in reimbursement to providers through Medicare, and every year. Actually, it was supposed to decrease them. I got it wrong. They're supposed to decrease them, and every year they pass what's called the doctor fix to keep their decreases from taking into it. That's literally what it's called. I mean, you go look it up right now, look at the doctor fix, and it'll tell you. Bottom line is that the reimbursement rates have been sort of kept low as a result.
Well, the reimbursement rates have been kept low, and they keep decreasing them in many instances for many of the procedures that are done. So if we look at the cost of inflation, and then we look that they keep decreasing those reimbursement rates. So, and all of those things play into account when you're trying to attract a physician workforce here in the state.
Yeah.
There are huge issues with that because we have a large Medicare population as well. So we have a large Medicaid, a large Medicare population, and so when you're trying to attract those providers into the state, all of those things play into that. And I've seen my husband and them try to recruit people into the state from out of state, and they're looking at those payer mixes, and they're
they go to another state and get paid a lot more money for the same work.
Yes, and even just to our surrounding states, are so they can have a good Southern quality of lifestyle, but then they can get paid and reimbursed a lot more money for doing the same amount of work. And so those are things that are limiting us as a state in being able to bring people in.
Well, that's something that has been talked about quite a bit. Is that we need more physicians to increase supply here.
Yes.
We got lots of healthcare deserts, if you will, and it doesn't help when you have lower reimbursement rates. I think it's fair to say you made this point a minute ago. Probably one of the main reasons we even have the degree of adequate coverage that we have now in the States, because these people want to live here. They're native Mississippians, and they want to serve their communities.
Yeah, and every time I see a young person go out of state, especially a healthcare provider, it breaks my heart because the people that are serving these communities, they care about the state, they love the state, and they want to take care of their neighbors, and they love their community. So, but you do see young people saying, "Hey, I can still have a good quality of life for my family, and I can go out of state," and that's something we've got to reverse the trend on, because then that has a ripple effect. When you have a major company coming in, they're looking at healthcare workforce. They're looking at hospitals and all of that. So it all has this ancillary effect on our ability to grow our economy.
Well, and Dr. Edney, you've heard him talk about a lot how that affects our economy. I mean, he's had studies done that talk about our unhealthy population and our number of people that don't have primary care physicians and those sorts of things.
Well, in rural hospitals too. I mean, you're not going to have a company come into an area unless they have an emergency provider within 30 minutes, 20 to 30 minutes of that company.
Yeah.
So these things all affect our ability to bring in industry. So
we got to keep working on it. That's
we
the bottom
absolutely
line.
do. So,
Senator, thanks for coming in. Have a great
you.
Fourth.
Have
Appreciate
a great
it.
Fourth.
You too. We're coming right back, folks, in the Element Wealth Studio.